Podcast 20, Week 22. Welcome to the podcast, Your Pregnancy Week by Week. This podcast covers the 40 weeks of pregnancy in 38 segments and is based on the book Your Pregnancy Week by Week by Dr. Glade Curtis, MD, and me, Judith Schuler, MS. The information in our books and podcasts is a general informative guide about pregnancy. None of the information we provide is intended to replace, countermand, or conflict with the advice given to you by your own doctor. Always follow his or her advice. Use the information you learn here as a starting place in your dialogue to help you put your pregnancy concerns, questions, or interests into words. The goal of every pregnancy is a healthy mom and a healthy baby. To that end, our podcasts cover many topics. In each weekly podcast, we'll highlight information contained in the same weekly discussion in our book. We suggest you read each weekly chapter to learn further information, such as how baby is growing and changing and how you're growing and changing too. Our book also contains illustrations of changes in baby or you, advice for dads, charts, lists, boxes, an exercise for every week, a comprehensive glossary, hints, tips, snippets, and blurbs we just can't reproduce in a podcast. So let's get started on this week's discussion. We're going to look at week 22. It can be hard to determine if a woman might deliver her baby early. A test has been developed to help doctors determine if a woman might be at risk. It's called the fetal-fibronectin test. Fetal-fibronectin is a protein found in the amniotic sac and fetal membranes. If it's found in cervical vaginal secretions of a pregnant woman between weeks 22 and 38, there's a higher risk for preterm delivery. Has your doctor mentioned anemia? It's a condition in which the number of red blood cells is too low. It can cause you to tire easily, experience dizziness, and feel unwell. The most common type of anemia during pregnancy is iron-deficiency anemia. If you have iron-deficiency anemia, your body won't have enough iron to make red blood cells for you. Several things make developing iron-deficiency anemia more likely, including bleeding during pregnancy, carrying more than one baby, antacid overuse, and poor eating habits. The goal in treating the problem is to increase your iron intake. To do this, ask your doctor about what foods you should eat. Most prenatal vitamins contain iron, but you may need a supplement. You might have diarrhea during pregnancy. What should you do? The first thing is to call your doctor. He or she wants to know when you have a problem. Next, increase your fluid intake. Drink more water, juice, and clear fluids such as broth. A bland diet without solid food for a few days is okay and can help you feel better. Don't take any medication to control diarrhea without first checking with your doctor. And if diarrhea lasts longer than 24 hours, let your doctor know. He or she will advise you. Did you know eating dark chocolate during pregnancy may be good for you? If it contains at least 70% cocoa, it may help lower blood pressure and reduce the risk of anemia. The catch is dark chocolate should replace any other sweets you might want to eat, and don't have more than 1 ounce a day. We mentioned increasing your fluid intake if you have diarrhea. That's not the only time to increase your fluid intake. You need to drink lots of water every day during pregnancy. It may help you feel better. You need extra fluids to help your body keep up with the increase in your blood volume. When you don't drink water, you can get dehydrated, and being dehydrated can reduce the amount of nutrients baby receives from you. You should take in 100 ounces of fluid every day during pregnancy. That's almost 3 liters. Water should account for at least 50 ounces. Water and food can make up another 20 ounces. The rest should come from milk, juice, and other beverages. Check your urine to see if you're drinking enough. If it's light yellow to clear, you're doing great. Dark yellow urine is a sign you're not. And don't wait until you get thirsty. By the time you are, you've already lost at least 1% of your body's fluids. Be careful with bottled water. Just because it's bottled does not make it safer to drink. One study showed up to 35% of over 100 brands of bottled water were contaminated with bacteria and chemicals. Appendicitis can happen at any time, even during pregnancy. Acute appendicitis is the most common condition requiring surgery during pregnancy. Pregnancy can make diagnosis difficult because some symptoms are typical in a normal pregnancy, such as nausea and vomiting. Pain in the lower abdomen on the right side could be round ligament pain or a urinary tract infection. Diagnosing an appendicitis can be hard because as the uterus grows, the appendix moves upward and outward. Tenderness and pain are located in a different place. Rupture of a pregnant woman's appendix occurs more often because acute appendicitis isn't diagnosed soon enough. Treatment is immediate surgery. Most physicians believe it's better to operate and remove a normal appendix than to risk infection if an affected appendix bursts. Sickle-cell disease is the most common hemoglobin disorder in the United States. Many groups are infected. In the U.S., most cases occur among Black African Americans and Latino Hispanics. If you have the disease, red blood cells become stiff and sickle-shaped and can get stuck in tiny blood vessels, cutting off blood supply and causing pain and organ damage. Cells also die more quickly, which causes anemia. Prenatal tests can determine if baby will have the disease or carry the trait. Most children with sickle cell disease are identified through newborn screening tests. During pregnancy, the disease may become more severe and pain episodes may be more frequent. But a woman with sickle cell disease can have a safe pregnancy. Early prenatal care and careful monitoring are needed. If you take hydroxyurea, it's not recommended during pregnancy. Another blood disorder is thalassemia, a different form of anemia. There are two main forms, alpha and beta. The type depends on which part of the hemoglobin lacks red blood cells. Most people have a mild form of the disease. Women with the thalassemia trait may be more likely to develop anemia during pregnancy and may receive folic acid supplementation. Treatment includes frequent blood transfusions and antibiotics. Chorionic villus sampling and amniocentesis can detect thalassemia in a fetus. Early diagnosis is important so treatment can begin at birth. Remember, our podcasts give you the highlights of what may be happening in any given week. Check our book, Your Pregnancy Week by Week, for more detailed information. You may also want to check out our book for partners, Your Pregnancy for the Father-to-Be. It covers pregnancy from a man's point of view and provides lots of valuable information a man may find very useful. If you want to find out more about our podcast, visit our website, yourpregnancyweekbyweek.com. If you're looking for something specific, check out the podcast topics list. It details topics covered in each podcast, so you can listen to a particular podcast or read a certain chapter week if you want more information, or if you want to check out something you missed or a topic we haven't covered yet.